Live video starting. Doing pretty well. Dear friends, very good evening. Children all who being here. It's really a great pleasure for me to join in this wonderful evening to discuss about alcohol abuse and chronic liver disease. This one area is one of the very complex area to understand because in Indian scenario, day in and day out, as a gastroenterologist, we'll be facing so much of alcohol related disorders. Among various alcohol related events which is happening in your human system, the one common thing in which the one common organ which is going to get involved frequently is none other than your liver. As you all know, liver does lot of metabolic functions in your body. It is almost doing around more than 1500 functions in your human body, and the liver weight which is going to almost around 1.5 kg of your body weight. So you just imagine, in case if you are going to take alcohol for a long duration of time, what are the various complications you are going to face? What are the various ways you are going to land up with multiple complications? If you are going to take alcohol, for example, for a period of time, or if you are going to take alcohol for long duration, or in case if you are going to consume alcohol in a huge binge manner, which means you are going to take multiple pegs of alcohol, you are going to consume beer, you are going to consume wine, you may consume whiskey, you may consume brandy, you may consume hard liquor, so many other things are there, toddy and so many other things. If you are going to consume, each and every component will be having a different alcohol base. Why I would like to point out this picture, if you are going to take alcohol doesn't mean you are going to develop liver disease, and if you're not going to develop if you're not going to take alcohol doesn't mean that you will not develop this any problem. Consume minimal alcohol, there is high possibility for you to land up with liver disease. And some patients, even if they are going to consume more and more amount of alcohol, they may not develop any liver disease. There are multiple reasons for that. If you want to discuss about this alcohol and alcohol related disorder which is going to get effect in your liver, there are so many pointers are there to discuss. Why? Because the first and foremost entity, if you are going to take alcohol for a long duration of time, the common problem what you are going to face is your liver related problem. Once your liver is going to get affected, in what way? There might be evidence that you are going to land up with liver disease. How do you going to recognize that you are going to develop a liver disease? I will be sharing my personal experience in this area because this is my initial attempt of doing to create a public awareness in India how to overcome this alcohol related abuse successfully. Because whenever I am going out, I will be seeing multiple populations who will be standing outside the rack shop consuming alcohol daily, day in and day out. The family members are suffering, the real families are suffering, even the patient is going to get suffer because of that. So how to overcome this? That's most important. So you can ask your doubts here, you can chat with me at any point of time. to overcome all these problems successfully. The most important thing, if you are going to take alcohol for a longer duration, the first and foremost event, you may develop a fatty liver. What is this fatty liver? If your liver is going to contain more than 15 to 20% of your fat of the normal liver weight, which means there is high possibility for you to land up in fatty liver. This fatty liver, you will be doing ultrasound, you will be doing routine examination, you will be having multiple reasons for you to do an ultrasound examination. When you are going to do your ultrasound examination, there are many patients who have been diagnosed as fatty liver. This fatty liver, you need to be very, very cautious, because once the patient is going to land up with fatty liver, there is high possibility for this patient to develop multiple other complications, because as the day progresses, you may land up with liver fibrosis, and alcoholic steatohepatitis is one dangerous complication will develop, and next to that you may land up with cirrhotic background. Cirrhosis is nothing but your entire liver is going to get shrunken off. Once your liver gets shrunken off, you are going to land up in an entity what is called as a chronic liver disease. In this chronic liver disease, there is two entities. One is compensated and one is decompensated. What is this compensated? What is this decompensated? Once you are going to land up in this decompensated chronic liver disease, you may need liver transplant, which is one of the very costly affair for a normal Indian population to do. Why you want to put yourself in trouble like this? How to overcome? In case if you are going to have this alcohol abuse, alcohol use disorders, you consult your gastroenterologist as early as possible. Screen yourself that your liver has been injured or not. And with that, once your liver is injured, there are so much of medications is there now in the field of gastroenterology to overcome all the complications successfully. The first and foremost thing, if you are going to take alcohol for a longer duration, you may develop evidence of jaundice. Jaundice is nothing but yellowish discoloration. If your eyes as well as if your urine, if it is going to be high yellow in color, which means you are going to land up in jaundice. Always you should remember certain points, that whether your liver has been involved or not. To a general public, I would like to state that, how do you know that your liver been affected? We don't know whether your liver, see, most of the patients who have been visiting me, they don't know what is the reason for this problem. They might be having high colored urine. The urine will be dark yellowish in color. And some patients will be having high colored yellowishness in the eyes. They couldn't able to recognize the problems well. And some patient will be having persistent itching in the body. And some patient will be having a bloatedness of your abdomen. The tummy will be becoming very big. They don't know what is the reason. There are so much of populations who are coming from periphery, who are coming from other parts of India other than Tamil Nadu. I'm telling you, in India, almost around 140 million populations throughout the world, as of now the data have been showing, they have been dying because of, they've been involved because of alcohol related liver disease. So as of now, this is the data which has been collected from 2020 to 21. Why I would like to point out this, unless you have the mind to take on this concept, unless you have the mind to avoid alcohol, it's very difficult for you to cut down this bad behavior. Unless if you're not going to do that, there are so many organ systems you are going to be involved. You may have involvement of your liver, you may have involvement of your brain, you may develop involvement of your kidney, you may develop involvement of your lungs, you may develop involvement of your heart. There are so many other organ systems which may get involved because of this alcohol related disorders. So you need to be very, 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 very cautious how to overcome these problems promptly. So you need to make sure whether do you have any bad habits is there or not, and you need to analyze how this bad habits been significantly involved. See, is it possible for you to cut down this bad habit? There is a questionnaire what is called as cage questionnaire, CAGE. It's nothing but cut down. C stands for cut down. Is it possible for you to cut down the bad habits? Second thing, is this bad habit keeps on annoying you? A stands for annoying. Annoying means which is troubling you. Second to that, G, do you have any guilty? Even if you feel guilty and followed by you are going to consume alcohol, that is one bad thing you should not forget, because your guiltiness has to stop this bad behavior. But even with your guiltiness, if you couldn't able to do that and you keep on consuming alcohol, there is strong pointer for you to consult a gastroenterologist. Next to that, high opener, is there any problem which is being involved? So all these pointers to be analyzed properly. In case if you are going to land up with 2 or more points, there is high possibility for you to land up in alcohol related disorder. So recognizing the liver disease early is very important. If you are overweight, if you are having any thyroid problems, in case if you are having any heart problems, in case if your body mass index, if you are obese, in case if you are going to be hypertensive, in case if you are going to have a metabolic syndrome, you may develop it with this kind of complications. So always aware, be aware to overcome, not to take alcohol, abstain yourself from alcohol, have a stable mind, be energetic, always be positive, never take alcohol. That is the first and foremost important thing. Right now in this area and this great initiative to discuss with you all, it's the most important aim, motive for me to have a trigger to in this concept to discuss with you. So if you are going to have any of these problems, if you are going to land up, always you remember, if you are going to develop jaundice, which means you are having yellowishness of your eyes. In case if you are going to develop any abdominal prominence, as I discussed with you, in case if your legs is going to get swollen out, in case if you are having breathing difficulty, and in case if you are going to develop any palpitation, in case if you are going to develop any giddiness, in case if you are not able to retain your mind well, you frequently have forgetfulness in your daily routines, there is high possibility for you to have a alcohol induced liver disease. And next and foremost important thing, once this liver disease forms, as I discussed with you, these are all the pointers you should not forget. And you may have a dangerous vomiting, what is called dangerous vomit related symptoms. There may be a blood vomiting, maybe there. So why? Because of your liver pressure, it's going to get increased. Once your liver pressure, what is called as portal hypertension, once the liver pressure gets augmented, there is high possibility for you to develop blood vomiting. Your vomitus may contain lot of blood. You may sleep well in the night time, and next day morning when you are going to get up, you may have a dangerous blood vomiting. For that you need to seek a gastroenterologist's opinion early. They may do an endoscopy to you, they may diagnose your problem, and followed by, there are so much of treatment advent has been happening in the field of gastroenterology to overcome these problems. But is there any complete solution for this? As of now in India, except liver transplant, there is no complete solution for that. You all should remember, why do you want to go for liver transplant? God has gifted you a wonderful liver. There are so many reasons for you to develop a liver disease, not only because of alcohol. You should always remember, in Indian scenario, around 40 to 50, 30 to 40% of the population, the liver problem is mainly because of alcohol related problems. Apart from that, there are so many other reasons. One is because of your virus, and one is because of other things. There are so many other reasons for that. Even in pediatric, even in very small children, they may have liver disease. There are so many etiological factors, etiological triggers, in which I have discussed about all these things in my previous videos. But this one problem of your alcohol abuse is one dangerous entity you should not forget. Because blood vomiting, if it happens, you may have terrible infections in your body. That is what is called as spontaneous bacterial peritonitis. What is this? You may have severe abdominal pain. So in order for the Tamil population to understand clearly, I would like to make this statement in Tamil. See, liver பாதிப்பு உண்டாச்சுன்னா குடியினால் ஏற்படும் லிவர் பாதிப்பு அப்படின்றால் குறிப்பாக லிவர் இன்வால்வ் ஆகுது அப்படின்றது எப்படி தெரிய வரும் அப்படின்னா, மஞ்சள் காமாலை முதல் அறிகுறி. நிறைய பேருக்கு மஞ்சள் காமாலை வரும், ஆனால் அது லிவர் தான் காரணம்னு சொல்ல முடியாது. ஏன்னா நம்ம உடம்புல மஞ்சள் காமாலைக்கு பல காரணங்கள் உண்டு. ஒன்று லிவருக்கு முன்னாடி, லிவருக்கு பின்னாடி. That is what is called as pre-hepatic, intra-hepatic and post-hepatic. ஸோ இந்த லிவருக்கு முன்னாடி வர காரணங்கள் நிறைய இருக்குது. சின்ன குழந்தைங்களுக்கு மஞ்சக்காமலை வரலாம், பிறந்த குழந்தைக்கு மஞ்சக்காமலை வரலாம், பெரியவங்களுக்கு மஞ்சக்காமலை வரலாம், ஸ்கூலுக்கு போகிற குழந்தைங்களுக்கு மஞ்சக்காமலை வரலாம். ஸோ நிறைய பேருக்கு ஜாண்டிஸ் வரலாம். பட் குடினால் வரக்கூடிய ஜாண்டிஸ் வந்து கொஞ்சம் மோசமான விஷயம். அதை ப்ராப்பராக பார்க்கலன்னா நிறைய ப்ராப்ளம் லேண்ட் அப் ஆகிடுவீங்க. அந்த குடினால் வர மஞ்சக்காமலை எப்படி பிரதிபலிக்கும்? பேஷண்ட்க்கு வயிறு வலிக்கலாம், வாந்தி எடுக்கலாம், மோஷன் தண்ணியாக போகலாம், வாய் வழியாக ரத்தம் வந்துகிட்டே இருக்கலாம், மோஷன் வழியாக ரத்தம் வந்துகிட்டே இருக்கலாம். இந்த வயிறு பிரச்சனை பொறுத்த வரைக்கும் ஒரு உறுப்பு தாக்கப்பட்டால் பல உறுப்புகள் தாக்கப்படும். ஒரு பிரச்சனை வந்துருச்சுன்னா பல பிரச்சனை வரும். எப்படி குடும்பத்தில் ஒரு பிரச்சனை வரும்போது அதை நம்ம பெருசாக்கும் போது அது பல விதமாக உருவாகுதோ, அது மாதிரி இதில் ஒரு பிரச்சனை வரும்போது அதை நம்ம தூண்டிவிட்டால் நமக்கு பல பிரச்சனை நேரக்கும். ஸோ மஞ்சக்காமலையை சாதாரணமாக எடுத்துக்கக்கூடாது. இதற்கு மாற்று மருந்து நிறைய பேர் கொடுக்குறேன்ற சார்பில் நிறைய மருந்து சாப்பிட்டு இன்னும் மோசமாக எங்ககிட்ட வராங்க. அப்போது இந்த இதுக்கு அட்மிட் பண்ண வேண்டிய அவசியங்கள் வரலாம். பேஷண்ட்டோட உயிருக்கு மோசமான நிலைமை வரலாம். உயிருக்கு போராடுற நிலைமை இந்த மஞ்சக்காமலைனால எப்படி வருது அப்படின்னா, மெயினாக மூச்சு திணறல் ஏற்பட்டுரும், வயிறு பெருசாக வீங்கிடும். அதாவது என்னோடய ப்ரொஃபஸர்ஸ், பெரிய பெரிய ஜாம்பவான்கள் இந்த ஃபீல்டில் கேஸ்ட்ரோஎன்ட்ராலஜியில் சொல்கிறது என்னென்னா, இந்த நோய் பாதிக்கப்படுவது எப்படி தெரியும் என்றால், ஏழ்மை உனது மேல் தோலிலும் செழிப்பு உனது வயிற்றிலும் இருக்கும் அப்படின்னு சொல்கிறாங்க. அப்படின்னா எலும்பு வெளியே தெரிகிற அளவுக்கு ஒல்லியாயிடுவாங்க, ஆனால் வயிறு மட்டும் பெருசாக இருக்கும். ஸோ யூ மே ஹேவ் பாவர்ட்டினஸ் இன் யோர் செஸ்ட் அண்ட் வெல்த்தினஸ் இன் யோர் டமி. டோன்ட் ஃபர்கெட் தட். நெக்ஸ்ட் தட், வயிறு உபசம், கால் வீக்கம், மூச்சு திணறல், மஞ்சக்காமலை முற்றி போகிறது, மஞ்சக்காமலை அளவு ஜாஸ்தியாகிறது, ரத்த வாந்தி வர்றது, இந்த மாதிரி பிரச்சனைகள்லாம் லிவர் பிரச்சனையோட அறிகுறி. ஸோ லிவர் ஃபங்க்ஷன் ஒழுங்காக நடக்கலைனாலே இது வந்து ரொம்ப ப்ராப்ளமாக வாய்ப்புகள் உண்டு. Liver function has to be taken care promptly. You need to address your liver problems promptly. In case if you are going to land up with mild jaundice, early onset presentation, you need to consult the gastroenterologist as early as possible. If you are having worsening of events, depend upon your severity, you may be treated by the gastroenterologist for a longer duration of time. until and otherwise, until your jaundice and other symptoms has been taken care successfully. So you should not forget four most important thing. Liver disorders is very very dangerous entity. That too mainly because of alcohol, because you are going to land up with cirrhosis, which is nothing but a shrunken out state of your liver. So followed by you are going to land up with other complications. And I want to tell you certain things. There are certain population in India who are at risk. The female population, பெண்களுக்கு இது வந்து ரொம்ப ஆபத்து, பிகாஸ் த பாடி வெயிட் இஸ் ஆல்ரெடி லோ. யூஸ்வலாக ஆண்களை விட பெண்கள் வெயிட் கம்மியாக இருப்பாங்க. த மெட்டபாலிசம் வில் பி என்டையர்லி டிஃப்ரெண்ட். அவங்களோட உடல் பரிமாணங்கள் எல்லாம் வேறு மாதிரி இருக்கும். ஸோ அவங்களோட என்சைம் ப்ரொடக்ஷன்ஸ் வில் பி என்டையர்லி டிஃப்ரெண்ட். அண்ட் தெர் ஆர் ஸோ மெனி அதர் பாத்வே, ஸோ மெனி ரீசன்ஸ். இந்த பெண்களுக்கு மாதவிடாய் இந்த மாதிரி நிறைய விஷயங்கள் இருக்குது. ஸோ தெர் ஆர் ஸோ மெனி ரீசன்ஸ் ஃபார் எ விமன் பாப்புலேஷன் இஃப் தேர் கோயிங் டு டேக் ஆல்கோஹால் ஈவன் ஃபார் எ ஷார்ட்டட் டியூரேஷன். கொஞ்ச நாள் குடித்தாலே பெண்களுக்கு வந்து லிவர் சீக்கிரமாக கெட்டுப்போயிடும், ஆண்களை விட வேகமாக கெட்டுப்போயிடும். Nowadays the current pathetic scenario in India, I am seeing more female populations are being taking alcohol, that too in Chennai and other cities. Why I am saying this? If in case if a female population, if they are going to take more and more alcohol, there is high possibility for them to land up with more and more complications. So better avoid alcohol, save your family. Because I have seen recently a pregnant woman who just completed 30 years of gestation. அதாவது கர்ப்பமான பெண், 30 மாதங்கள், 30 வாரங்கள் நிரம்பிய பெண். அந்த பெண் ஒரு சக பார்ட்டியில் முன்ன பார்ட்டி அக்கேஷன் she drank alcohol, followed by she had blood vomiting, and that patient has been referred to me. 30 weeks of gestation and she had alcohol abuse, followed by she developed blood vomiting, and already she is known case of liver disease. Even with the background of liver disease, she conceived by God's grace, and followed by she drank a huge amount of binge of alcohol in a social gathering, followed by she had terribly bad blood vomiting that precipitated multiple complications. So do you want to face it? No. There is a question over here in the chat box. I would like to address that question. I think Mr. Yuvraj, I have been asked a question about his relative is very much addicted to alcohol. He is weighing around 1 or 2 kg. Any way to reduce his weight? It's really a good and interesting question. But out of box discussion. See, how to reduce your weight. If you are going to take alcohol, you are going to provide too much of calorie. That is what is called as empty calorie. Which means உங்களுக்கு நிறைய சத்து கொடுக்குற மாதிரி தெரியும், ஆனால் அது எதுவுமே பிரயோஜனப்படாது. அந்த ஆல்கஹால் இஸ் கோயிங் டு டிஸ்ட்ராய். உங்களுக்கு தேவையற்ற கொழுப்புகளை அதிகமாக்கும், உங்களோட ப்ரோட்டீன் மெட்டபாலிசத்தை இன்வால்வ் பண்ணாது. ஸோ பேஷண்ட் இஸ் கோயிங் டு கெட் அஃபெக்டட் பிகாஸ் ஆஃப் திஸ் ஆல்கஹால் ரிலேட்டட் டிஸார்டர். So how to overcome that? If you are going to take too much of alcohol, the first and foremost thing, you need to stop alcohol if you want to reduce your weight. How to stop alcohol? You may need a psychological support, you may need a psychiatric consultation, you need to consult your gastroenterologist, you need to do the basic workup, and then you need to abstain yourself from alcohol. How to reduce your weight? The foremost important thing is diet as well as lifestyle modifications. What is this diet and lifestyle modification? You need to do a physical activity of aerobic exercise at least 45 minutes in a day, 5 to 6 hours in a week. And next to that, your diet should not contain high carbohydrate or high fat. This will precipitate your problem. You need to target a sustained weight loss, but it should not be rapid weight loss. So many populations are discussing about keto diet, other diet. That is not my intention to discuss here. But If you want to reduce your weight, a sustained weight loss is very important. Physical activity is very important. Diet modifications is very important. And serial weight loss is more important. Rather than producing a rapid weight loss. Even with that, if your weight, see this kind of morbidly obese, which means the BMI will be more than 30. So இந்த அளவுக்கு குண்டா இருக்கிற பேஷண்ட்ஸ்லாம் it will be very difficult for them to do that. So the endoscopy innovations are so high, we can place a balloon in the stomach. That is what is called as endoscopic balloon modality to treat this obesity. There are so much of therapies are there. We can do a multiple stitching and other procedures in order to overcome this obesity related major problems. Always you should remember that if you are going to be too obese, if you are going to land up with obesity, that is separate area to address. You may have heart problems, you may have liver problems, you may have brain problems, you may have breathing problems, you may develop a throat related problems, you may develop a breathing disorders, what is called as obstructive to a good physical activity, diet modifications, control. So the liver transplant in India is going up very well. The innovation in liver transplant has been gone very well. But how far it has been reached to the poor persons? That one question to be addressed. Is it feasible? Because two modality of liver transplant. One is by living donor, one is by cadaveric donor. So living donor means உங்களுக்கு தெரிஞ்சவங்க யாராவது லிவர் கொடுத்தா ஓகே. Cadaveric donor means இறந்தவங்க கிட்டேருந்து லிவர் எடுக்கிறது. ஸோ ஆல்மோஸ்ட் பிரெயின் டெட் பேஷண்ட்ஸ் இறக்கக்கூடிய நிலையில் இருக்கிறவங்க. ஸோ இந்த மாதிரி நிலைமையில் இருக்கும் பொழுது லிவர் டிரான்ஸ்பிளான்ட் பண்ணப்படுகிறார்கள் அப்படி என்றால் அவங்களுக்கு நிறைய செலவாகிறதுக்கு வாய்ப்பு உண்டு. அந்த மாதிரி நிறைய செலவு பண்ணும்போது ஒரு 7 to 10 days of hospital stays. Even after 7 to 10 days of hospital stay, the patient need to be in regular follow, long term medications. நீண்ட நாட்கள் மருந்து தேவைப்படலாம். Immunosuppressive regimens are there. So much of medications are there. But even with liver transplant, some patient may fail again. They may need a repeat liver transplant. They may need to go for liver transplant again. There are so much rejections may happen. So why I would like to point out, you want to land up in this kind of complications only because of alcohol. If you deserve to do that, you can go with that. Hope so. With this lecture, with this brief discussion, I expecting you all that quit alcohol acid, because alcohol is one very bad entity which is going to spoil your life, spoil your society, spoil your environment, spoil your child's life, spoil your spouse's life, and all those complications may develop. And your family environment, family life, your mental stress, your physical health, your mental health, your social health, all those things is going to be well affected because of this liver related problem. So screen your fatty liver, prevent your liver fibrosis, take a good nutritious diet, take care of your nutrition. much of medications, innovations, endoscopy, all this complication. If you have any doubts, feel free to communicate at any point of time. Also, India is supposed to be free from this alcohol major dreadful problem. Jai Hind. Thank you very much. Good night for patience.